Facet Fusion. Introduction. Can you point to the vertebrae? Choose one of the following options. Correct. Can you point to the discs? Choose one of the following options. Correct. Are heart attacks and other anesthesia-related complications common during and after the surgery? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you've had in the past, such as heart attacks and lung problems. Are infections very common after spine surgery? Select yes or no. Correct. Infections are very rare, but infections, bleeding, and scarring may happen. Paralysis and weakness are very common after spine surgery. Select true or false. Correct. Paralysis and weakness are very rare in spine surgery. Although these complications are rare, they can still happen. It is impossible to injure the blood vessels and intestines in this surgery. Select true or false. Correct. It is extremely unlikely, but not impossible, for the blood vessels and intestines to be injured in this surgery. Can the fusion fail? Select yes or no. Correct. This can happen and is more likely in patients who smoke. The operation may have to be repeated. The operation is always successful. Select true or false. Correct. The operation tends to be very successful, mainly in relieving leg pain. However, it may fail in helping the symptoms. There is also a small chance that the symptoms may become worse than before the operation.
Thank you for using Explain.